In this video, I share a presentation I made to my audience on my membership website, theinnercircle.drdavisinfinitehealth.com, where we talk about topics that empower you and try to free you from what I call the tyranny of the healthcare system. In this case, I talk about how men can take natural steps to maximize their testosterone level to ideal levels and thereby hopefully avoid reliance on exogenous testosterone like testosterone pellets, injections, creams, or gels. There are indeed a number of steps men can take to maximize their testosterone if their levels are low and obtain all the benefits that testosterone provide. You'll see that there are some very unusual strategies, all safe and natural, but unusual and unexpected and often not talked about because the medical system is too eager to put you on medications to treat low testosterone and not tell you that there are natural ways to augment your testosterone status. And then this was followed by about an hour's worth of discussion about these topics. And then further on in the evening, we talk about some other topics. But it's an effort to support you in your natural efforts and minimize your reliance on the healthcare system. So I call this the natural management of testosterone in men, optimizing testosterone without testosterone replacement. So what this is not is how to use topical testosterone or injectable pellets or some other means of artificially boosting testosterone. There's a time and place for that conversation, but it's not going to be tonight. This is a conversation about more what you can do to boost your own testosterone levels and its effects on the various body organs without having to resort to an external replacement. So we're going to talk about the effects of aging on testosterone. We'll talk about why is this important? Why is it important to know what your status is in testosterone? What implications does it have? What consequences does it have for health? What's the role of abdominal visceral fat? It's a big role. The role of vitamin D. Surprisingly, vitamin D, this thing we've been doing for many years, of course, has a fairly major influence over testosterone levels. Endotoxemia, this thing we seem to talk about every week. Endotoxemia plays a huge role in testosterone. You've likely not heard that before, but there is good evidence that endotoxemia has a major effect on testosterone levels and the effects on various organs. The role, of course, of our good friend Lactobacillus reuteri via oxytocin on testosterone levels, and the role of exercise, if any. So we know with good evidence from studies such as this, the long-standing Baltimore longitudinal study on aging that started many years ago, enrolling about 900 males in their 50s and looking at testosterone levels as men age. And there's a clear, it's kind of hard to see that line behind the squares, but there's a declining line. As a male gets older, total testosterone levels decline. But you can see this wide variation. You can see young men with low testosterone. You can see older men, they're 60s and 70s, with high testosterone. But in general, speaking generally, as you age, total testosterone levels decline, though there's great variation. The protein that binds testosterone, sex hormone binding globulin, also increases, and that protein binds testosterone, making it less available for tissues, and thereby reducing so-called free testosterone. So total testosterone declines as we age. Sex hormone binding globulin increases, binding up testosterone and making free testosterone less available. But once again, you can see, you can be younger in your 30s, say, and have a low free testosterone. You can be in your 60s and still have a high free testosterone. So it has to be approached individually, but speaking generally, it does decline. But it declined, the effects of testosterone, not so much the levels, but the effects decline more than you'd think, especially if you combine the measures of total testosterone divided by free testosterone, the so-called free T index. And you can see those hatched lines. Those are the higher levels of lower free testosterone as a male ages. You can see that in the 60s, 70s, and onwards, that it becomes the rule. as a male approaches his 60s and 70s, low effective levels of testosterone become extremely common. What implications does that have for health? Well, it has very broad implications on multiple organs: bone, muscle, nervous system, adipose tissue, immune system. But the ones we'll focus on are low testosterone leading to reduced muscle mass and strength, thereby mobility and independence, increased total and abdominal visceral fat, reduced bone density, increased potential for depression and decreased energy, reduced libido, increased risk for cognitive impairment and dementia. There are many other factors, of course, but this is one factor. Low testosterone can be one factor. And erectile dysfunction, of course. And we'll address lifestyle factors that reduce testosterone or make it less bioavailable. And of course, the remedies for all these conditions as well. So we know with good evidence that the more abdominal visceral fat you have, the less testosterone you're going to have. Now, here's a graph of testosterone versus triglycerides. Recall that triglycerides, especially fasting triglycerides, are a pretty reliable index of your degree of overweight, insulin resistance, visceral fat, right, and liver de novo lipogenesis because of your consumption of carbohydrates and sugars. So here, the higher triglycerides go in general, the lower the total testosterone. So you can use triglycerides as kind of this crude index, an indirect index of testosterone status and the status of other markers like insulin resistance. Likewise, the size of fat cells. The more obese you become, the larger fat cells become, and the larger the fat cells are, the less free testosterone a male has. So we don't measure, of course, fat cell volume. It requires a biopsy, but the higher the triglycerides, the more fat you have, the lower the testosterone levels. So fat being a major determinant of your testosterone status. We have this added dimension to overweight and too much fat, and that is the increase in the activity of the aromatase enzyme. This is a little bit sketchy, but there's pretty much agreement that this is a real phenomenon. So abdominal fat expresses an enzyme called aromatase that in a male converts testosterone to estradiol and estrogen. So males who have more abdominal visceral fat have higher levels of estrogen, which makes them more prone to depression. So ladies have lots of estrogen and they're well accommodated to it. But if a male has too much estrogen, he tends to get depressed. He develops breast enlargement, which is very embarrassing for a male, right? Gynecomastia. Social isolation. It impairs their ability to socialize and feel comfortable, and they can become infertile. So having high estrogen levels in a male with abdominal visceral fat and low testosterone is not a good thing. Now, we talked recently about how to measure abdominal visceral fat. So if you want to quantify and track it in your program, there are ways. The easiest ways is a waist circumference, or even better, a bioimpedance device, a smart scale that includes some quantification, scoring, or pounds or kilograms or some measure of abdominal visceral fat if you want to track it. And if you don't know what I'm talking about, look back at the conversation we had just recently. How about vitamin D and its effects on testosterone? Here's one study: 165 males, middle-aged, given about 3,300 units of vitamin D over a year. And look what happened. Total testosterone went up by about 25%. It's not a huge increase, but 25%, nothing to sniff at. Likewise, bioavailable testosterone, or free testosterone, a surrogate for free testosterone, likewise went up about 15-20%. So vitamin D appears to have a beneficial effects on testosterone, though it's not all roses, because there also is a rise in sex hormone binding globulin. The net effect, however, nonetheless, is a modest rise in free testosterone. So vitamin D does play a role in managing testosterone status. So it is important. And look at this as an interesting aside. In this case, about 12 pounds, 6 kilos lost just with vitamin D. I don't think that's the rule. This seems to be an exceptional case in this study, but know that probably via influences on reducing insulin resistance, vitamin D can be a component of an effort to lose abdominal visceral fat and to help sustain higher levels of testosterone. Now, the evidence supporting the role of vitamin D in maintaining testosterone and other factors is deeply flawed. This is true for the entire vitamin D literature. It's true for many things, but vitamin D in particular, because most studies fail to specify the form of vitamin D. Is it D2 or D3? Is it oil-based? Is it powder? Is it a tablet? Recall that they vary widely in their absorbability. Low doses are typically used. It's not uncommon to see 400 units, doses that you and I would laugh at, right? Now that study used 3,300. That's a more respectable dose. They often use weekly, bi-weekly, or even monthly dosing, which we know with good evidence does not work very well. It's daily dosing that works. Something weird happens when you do large doses, like a common schedule would be 50,000 units per week, often of D2, sometimes D3. That does not work very well. Those kinds of large doses are metabolized differently, likely via a different pathway, because you overwhelm the primary pathway. So some of these studies use this kind of bi-weekly or monthly dosing. We know that does not work. Failure to factor in body weight or body fat, because we know that fat sequesters vitamin D. And the more fat you have, the less effect it has. So a slender guy might have, let's say he takes 10,000 units of vitamin D, and his 25-hydroxy vitamin D blood level might be 73. A guy who's, let's say, 260 pounds, same dose, his 25-hydroxy vitamin D blood level might be 31. So unless you factor in weight and proportion of fat, you won't know what the effect of vitamin D is, including on testosterone. And of course, failure to seasonally adjust, because vitamin D fluctuates with seasons, right? More sun exposure in the summertime when you're outside wearing shorts and a t-shirt, as opposed to an overcoat and boots and a hat in wintertime. So you have to, if you want clean data, including its effects on testosterone, you must factor in all these variables, which has not yet ever been done. So we have sloppy data, but the data that exists suggests vitamin D does have a modest effect on increasing both total and free testosterone. So the effects of vitamin D are likely underestimated. It's probably a little bit larger. We don't know, maybe 25%, maybe 30%, but it's probably better than the 15 or 20% documented in that one study. We also know that inflammation anywhere in the body reduces testosterone. That can be regardless of the source. It could be abdominal visceral fat. It could be lack of vitamin D, which is pro-inflammatory. It could be lack of omega-3 fatty acids. These are all, of course, familiar to you because we address all these things. Or endotoxemia. But any form of inflammation tends to reduce testosterone. Let's talk about the effects of endotoxemia. So here's a study that corroborated that the more fat you have, the lower your testosterone, both total testosterone and free testosterone. You can see once again, you can have low body fat and still have, you can have low body fat and still have low testosterone. So it's not that body fat is the sole determinant, it's only one of the determinants. This analysis here suggests there are other things. So abdominal fat, big player in determining your testosterone status, but there's other things. So let's consider endotoxemia. Now, you can measure lipopolysaccharide, LPS, endotoxin, but another way to do this is to measure something called LPS binding protein. It's the protein that binds LPS, and that tracks very well with blood levels of LPS. So in this study, they measured this LPS binding protein, and the more LPS binding protein you had, the lower your testosterone, suggesting the more endotoxemia you have, the lower your testosterone. So look at this group of guys, the greatest degree of endotoxemia and the lowest testosterone, suggesting that endotoxemia has a major role in determining your level of testosterone. Now, this study clinches it. There are German groups who've done these kinds of studies, taking normal people and injecting them with endotoxin, which always astounds me because it's extremely hazardous to inject a person with endotoxin. Because if you miscalculate the dose even a little, first of all, even low doses make you very sick. Two, if you miscalculate even a little bit, we're talking about millions of a gram type dosing. If you miscalculate or misjudge a little bit, you could kill somebody. Nonetheless, these studies have been performed, in this case, 33 younger men, slender, injected with LPS endotoxin. Look what happens. There's a huge increase, in this case, almost a 500-fold increase in this inflammatory marker, interleukin 6, IL-6. Not a 10% increase, not a 50% increase, a 500-fold increase. Another inflammatory marker, TNF-alpha, in this case, only a 70-fold increase in TNF, huge increases in inflammation. And with the injection of LPS endotoxin, a dramatic reduction in testosterone. In this case, a 50% acute reduction in testosterone. We don't know what the effect is chronically with repetitive or constant exposure to endotoxin. It's likely to be a durable effect, of course, a prolonged effect. But in this case, a 50% acute reduction in testosterone when men are exposed to endotoxin. So a major influence, of course, on top of any effect of abdominal visceral fat and other sources of inflammation or lack of vitamin D. Now, our good friend, Lactobacillus reuteri, we know from the experimental data when a mouse is given reuteri, the size of its Leydig cell. These are cells in the testicles that produce testosterone. On the left, control animals. On the right, animals given Lactobacillus reuteri. There's a marked increase in the size of testosterone-producing Leydig cells. And accordingly, there's a marked increase, and you can see the tallest graphs are the size of Leydig cells in animals who receive reuteri. So marked increase in Leydig cell volume, and accordingly, as you'd expect, a marked increase in testosterone levels. So the animals who got reuteri, the control diet plus reuteri, there's about a 5-fold increase in testosterone levels. The next graph is new Western diet. That's their label for a fast food mimicking diet. You can see about a 9-fold, a 900% increase in testosterone levels. Now, it's not that big in humans. We did an informal experiment where we got about a 50% rise. So animals, huge rises. Humans, more like 50% rise in elderly males over 50. But telling us that reuteri, likely via oxytocin, exerts a major effect on testosterone levels. How about exercise? You'll often hear that exercise increases testosterone. There's some truth to that. The effect is not very big, it's small, and it may be indifferent to the form of exercise. We know that strength or resistance training is better in many respects. Here, it's not quite clear if it is better as compared to, say, high-intensity interval training or just aerobic or lesser forms of exercise like walking or biking. Here's a study with 48 men, average age 60, with 2.5 hours per week of exercise, meaning walking, biking, fairly leisurely, not very intensive. But comparing men who are sedentary, those are the black circles, to men who are habitual exercisers for many years. So when sedentary men exercised 2.5 hours per week, their level of testosterone approached that of chronic exercisers. So just modest exercise, walking, biking, etc., seems to be sufficient to at least take up the slack due to lack of activity, exercise. Likewise, free testosterone, when sedentary men exercise modestly, they get a rise in free testosterone that approximates or approaches the same level as guys who've exercised chronically for many decades. So exercise does have a role. It's not a big role, but it is a contributor. Now, this is a societal problem, not just a problem for those of us here. It's a big problem in the obese or the overweight, where fat is distributed. And recall that you don't have to be overweight or obese to have a lot of abdominal fat. You can be fairly slender, the so-called skinny fat phenomenon. Remember the CT scans we looked at, where even men with BMIs of 24 had lots of abdominal fat? So, but in general, obesity or overweight with excess abdominal fat, major factor in reducing total and free testosterone. Vitamin D deficiency, of course. So we want to keep that vitamin D up in a desirable range. Sebone endotoxemia, likely extremely major factors in distorting testosterone status. And of course, it opens the door to depression and anxiety, low self-esteem, social detachment, anger, antisocial. These should all be familiar because it's all around us, especially in younger males who have essentially, many of them have disengaged from society. And not all of it, but a lot of it is due to these phenomena and thereby the distortions of testosterone metabolism and to some degree a rise in estrogen, as well as loss of reuteri, right? And it even leads to low sperm counts and infertility. You've seen the drop-offs in reproductive rates among young men. This is not just a curiosity. It's not an academic question. This is a major societal issue. So how are we going to address this? Well, obviously, we're going to minimize total and abdominal fat. We, of course, do that through the program. You have the option of quantification with a bioimpedance scale, or at least waist circumference. Remember, don't bother with calipers. Don't bother with waist-hip ratios. Don't bother with all that nonsense. You want to get as close as possible to a direct measure of abdominal visceral fat, as well as total fat. Of course, you want to optimize vitamin D. We're not going to take capsule or powder forms. We're going to take oil-based gel caps. We're going to aim for a 25 hydroxy vitamin D level at what we view as the ideal or optimal level, which is 60 to 70 nanograms per milliliter. We're going to address, obviously, endotoxemia, SIBO and endotoxemia, using our unique approach of SIBO yogurt, that is Lactobacillus reuteri, Lactobacillus gasseri, Bacillus subtilis, microbes that colonize the small intestine and produce bacteriocins to push back the invasion of fecal microbes in the small intestine, thereby reducing endotoxemia. And of course, we've eliminated wheat and grains, that is the gliadin protein that increases intestinal permeability, and wheat germagglutinin that likewise is a bowel toxin and increases bowel permeability. So we've eliminated all that, right? So we've reduced endotoxemia and its contribution to reducing testosterone. We include reuteri, of course, whether it's by itself or as SIBO yogurt, and thereby all its effects on Leydig cells and testosterone production, not to mention its ability to target abdominal visceral fat. By the way, that's a very powerful combination. Lactobacillus reuteri, Lactobacillus gasseri, both reduce abdominal visceral fat. That makes further additional contributions, increasing both total and free testosterone levels. And of course, exercise. Enjoy exercise. Do something you have fun doing. It doesn't seem to matter that much what form of exercise you take, just do it. Now, should you track levels? Yeah, it's kind of helpful, but I think a better way to do this. So most of the advice on checking levels sets you up for testosterone replacement. We're not doing that. So I think the usefulness of testosterone testing, whether it's total or free, is to see what your status is and see if you can improve it using these natural methods, and then achieve a level that makes you feel good, where you think it supports your musculature, where you have control over strength, abdominal fat, libido, feelings of control, that is, you feel like you're in control of your life. I think that's a better way. Put it into the context of the way you feel. Don't just try to treat numbers blindly, and we're not going to resort to external testosterone replacement unless you really must, in the occasional instances where these basic maneuvers don't help. Thanks for listening.